Good morning, students. Myself, Harani, Assistant Professor in the Department of Agriculture Engineering. Today's topic is about type 1 disorders. In this video, we are going to discuss about what is disorder, what are all the type 1 disorder diseases. First of all, disorder is nothing but it affects our body's proper functioning. Sometimes it may have symptoms or it may not have symptoms. This disorder is occurred due to physical factor, mental factor, genetic factor, emotional factor, and functional factors. So, type 1 disorder. So, type 1 disorder is caused due to our lifestyle and stress related diseases. So, nowadays, people of all age groups, regions are affected due to lifestyle diseases. There is an evidence shows 17 million people are deathed due at the young age before the age of 70. It is due to physical immobility. So, nowadays, children's, adults, and elderly peoples are affecting non-communicable diseases, which is caused due to unhealthy diets, physical inactivity, exposure to high amount of tobacco and alcohol. So uh, these diseases are caused due to unplanned urbanization from shifting rural to urban areas, globalization of unhealthy lifestyles, population aging, unhealthy diets from healthy changing healthy diets to unhealthy foods, lack of physical activity, mental stress, which aids in blood pressure. So this increased blood glucose level, and fat level and obesity. So these are all the risk factors which uh, which is caused due which is caused by which is caused cardiovascular diseases, which causes premature death before attaining the age of death. So, stress related diseases and what are all the preventive measures? So, first of all, stress is defined as any type of change that can cause physical, emotional, and psychological change. So, types of stress is classified into two types. One is acute stress and chronic stress. So, not all type of stress is harmful. So, acute is nothing but it is a very short term stress that can end at the situation ends. So while chronic stress is never ending and inescapable. So this is the difference between acute stress and chronic stress. Acute is a short term. Chronic is stress continues for hours, days, and years. In acute, there is an anxiety feeling. In chronic, there is a depression, both depression and anxiety feeling. For example, of acute stresses, while giving a speech, uh, while the teacher asked to come in front and give a speech, a new challenge. So this acute stress ends at the end of the situation, but the chronic stress is it's a constant worry. It stays for hours, days, and years. So stress influenced. So these are all the conditions that stress influenced is diabetes. Can occur due to stress, hair loss can occur due to stress, heart diseases can occur due to stress, hyperthyroidism, obesity, and ulcers. There is a proverb, prevention is better than cure. Uh, Prevention is better than cure. Before the stress come, comes to us, we can manage the stress. If we follow the management steps, we can reduce the risk of the stress. For that, we need to manage few steps. First thing is we need to exercise regularly, have at least 20 minutes of 3 times a week, avoid conflicts. So avoid situation which makes you feel stressed or uncomfortable. So relax. So give yourself some time and to relax each and every day. So eat well. So a nutritious diet is important for a healthy life. Next is sleep. A good sleep routine is essential for reducing the stress. So enjoy your life. It is important to make life to have some fun and to get balance in our life. So the first disease is cardiovascular diseases. So this is nothing but affects. It is a group of disease which affects our heart and heart valves, arteries, blood vessels. So these diseases can affect many parts of our heart, like blood vessel, arteries, mm, heart valves. So these cardiovascular diseases include heart or blood vessel issues like narrowing of blood vessels in your heart. So narrowing is nothing but due to the plaque. So plaque is nothing but unwanted deposit liquid deposit. This is cholesterol. So narrowing, this is the normal artery of a person. Narrowing of artery is nothing but the artery gets narrowing, it gets widened. So it is due to liquid deposit of plaque. So there is a less flow of the blood vessels. So there may be sometimes a blockage occurs. The risk factors of cardiovascular diseases: high blood pressure, hypertension, high cholesterol, so high use of tobacco, so type 2 diabetes, family history of heart diseases, lack of physical activity, and having high weight or obesity. It is not. So the preventive measures of heart diseases is to consume healthy diet, to have a proper sleep, to quit junk foods, to quit alcohol. We need to manage the stress level. If we regularize uh, our body, it can prevent the risk of cardiovascular diseases. Hypertension. Next is hypertension. It is one of the common health problem which we are facing at the age of adult. So 20 percentage of adults across the world have this hypertension disorder. So it is nothing but having high blood pressure and a combination of high psychological strain. So blood pressure is measured by both systolic pressure and diastolic pressure. It is the average of two or more readings uh, where the visits after initial screening can be done of the pressure. So this is the pictorial image of normal healthy person artery, while uh, the right side image shows the hypertension person's arteries. There is a narrowing of diameter. It is visible. There is an narrowing interior of diameter. So here there is an increased wall thickness. Here you can reduce the reduced interior diameter because there is no increased wall thickness. So the causes of hypertension is acute stress and due to unfavorable environmental conditions. The increasing rate of prevailing condition is due to lifestyle, dietary factors, and inactive habits, high diet and high sodium content in diet from processed foods, tobacco, and alcohol use. So these are all the symptoms of hypertension. So the next disorder is obesity. It is nothing but excess accumulation of body fat in the body. So it is associated with the high risk of it can cause diabetes mellitus, high plasma triglycerides, heart diseases, gallstones, arthritis, gout, hypercholesteremia, hypertension, cancer, and mortality. So the obesity is calculated by body mass index. It is the indirect measure of body's obesity. So it is calculated by weight in kilogram divided by height in meter square. Obesity is caused due to a combination of excess food intake, lack of physical activity, and sometimes it is caused due to people's genetic suspectability. So, a few cases can be caused primarily by genes and endocrine disorders, that is, hormonal changes and mental disorders. So, many factors that contribute to the development of obesity. Uh, First is diet. So, overweight is an energy imbalance between both. Consumed on one hand and calories expended on other hand. The high intake of saturated fats, carbohydrate rich foods, consumption of soft drinks, sugars, etc. It also increases the weight or obesity. So how to prevent this obesity disorder? We can have weight loss treatment programs like diet and exercise, which are recommended as high blood pressure and obesity are related to each other. Having a well balanced diet by including whole grains, fruits, vegetables, and low-fat dairy products. Avoid foods that have a high amount of LDL cholesterol, that is low-density lipoprotein cholesterol. We can reduce the intake of sodium in the diet and increase the risk of calcium and vitamin D. So the treatment for this obesity is diet. We can have a diet therapy. We can exercise regularly. We can change our behavioral modification from unhealthy diet consumption to healthy diet consumption. We can have. We can take weight loss surgery, but it is prescribed with the help of doctor. Thank you.